ADME WorkBench Video 1, Introduction to ADME WorkBench. This is the first of a series of short videos created to provide basic instruction in the use of ADME WorkBench, a software application for predicting pharmacokinetics of drugs and environmental chemicals in humans and preclinical species. ADME WorkBench uses a suite of mathematical models to predict concentration profiles of toxic or therapeutic compounds in various tissues and matrices using available in vivo or in vitro data. At the conclusion of this series of videos, you should be able to understand the various parts of the ADME WorkBench user interface, import measured in vivo pharmacokinetic data, set up and execute a predictive PK study using allometric techniques, set up and execute a predictive PK study using in vitro and vivo extrapolation, execute simulations in both batch and interactive mode, explore and interpret results of a PK study, export results and predicted PK profiles. ADME WorkBench assembles a number of state-of-the-art methods for PK prediction. This collection of methods allows a wide variety of data to be used for PK prediction. These methods are configured and data is specified in an intuitive user interface in which compound and PK data is entered using a familiar spreadsheet format. Predictions for compounds may be run in either single or batch mode. All models and scripts are delivered with the product, enabling you to inspect and modify the models to suit your particular research needs. Predictive PK capabilities of ADME WorkBench include support for several state-of-the-art PK prediction techniques, including whole-body and lumped physiologically based pharmacokinetic models and allometry based on the Wajima approach. A PBPK model, which includes an advanced multi-compartment GI uptake model, support for both linear and nonlinear kinetics, and a variety of metabolism and excretion models. Support for end-user customization of any of the provided models. A choice of prediction methods depending on the availability of preclinical data, either determined in vitro and or in vivo in single or multiple species. Ability to integrate values of ADME parameters predicted from a broad range of methods. Ability to simulate a single compound or multiple compounds in batch mode. Simulation of tissue concentration at the macro level, meaning whole organ, and at the micro level, meaning cell or interstitial fluid, either for bound or unbound drug condition. ADME WorkBench was designed with four guiding principles in mind. First, flexibility. The specific methods used to predict human PK are influenced by what precisely needs to be predicted, and what data is available, and what predictive accuracy is required. ADME WorkBench includes a variety of models that can be assembled to accommodate a wide range of PK prediction problems. Second, ease of use. Complex models can have dozens or even hundreds of parameters that need to be adjusted for a particular PK analysis, potentially leading to a complicated and hard to understand user interface. The ADME WorkBench user interface avoids clutter by using a spreadsheet metaphor and only showing the necessary inputs or outputs for the model components required for the selected study. If you're comfortable with spreadsheets, you'll feel at home in ADME WorkBench. Third, openness. Some PK modeling packages include proprietary models which are hidden from the user. Moreover, if the user needs a modification to the modification needs to be done by the model vendor. In ADME WorkBench, all model source code is delivered and installed with the application, allowing end users to examine, understand, and even modify the models without requiring the cooperation of the tool developer. Fourth, best practices. The pharmacokinetic models used in ADME WorkBench are based on research resulting from the Pharma CP/CDC initiative on predictive models of human pharmacokinetics and described in a series of articles published in the Journal of Pharmaceutical Sciences in 2011. ADME WorkBench is composed of three components: a user interface, a set of PK and PBPK models and associated scripts, and a computational engine. The ADME WorkBench user interface uses a spreadsheet metaphor to organize information related to one or more compounds to be included in a PK study. It also contains the user interface elements associated with concentration plots and tabular output of model results and predictions. The PK and PBPK models and scripts used by ADME WorkBench use the modeling and scripting languages used by the AXL-X simulation platform. This includes the CSL language for defining the differential equations comprising the PK and PBPK models, and the M language for defining scripts which control the execution of the models. All model and script source code is delivered and installed with ADME WorkBench. ADME WorkBench uses the AXL-X computational engine, which executes the mathematical operations associated with the models. Specifically, it solves the differential equations comprising the models, performs parameter estimation, and executes scripts which coordinate the many computational tasks undertaken during a PK study. This concludes the ADME WorkBench introductory video. In the next video, we'll look at the ADME WorkBench predictive PK capabilities in a little more detail.